Welcome back to The Explainer. Today, we're tackling a topic where what you think you know could literally be dangerous. For decades, movies and TV have basically trained us on exactly what to do in an emergency. Or, well, so we thought. You know the tropes: suck out the snake venom, pee on a jellyfish sting, put a little butter on a burn. But when cinematic drama collides with real life, it turns out relying on those outdated movie myths can do way more harm than good. In this explainer, we're tearing down those old tropes and diving straight into the 2026 Red Cross first aid realities that actually save lives. Consider this a total upgrade for your mental first aid handbook. Here's our agenda for today. We'll be covering 1. Bugs, stings, and ticks. 2. Snakes, spiders, and bites. 3. Jellyfish and poison ivy. 4. Everyday eyes and dental care. And finally, 5. The modern first aid kit. All right, Section 1. Bugs, stings, and ticks. So, you get stung by a bee. Your immediate instinct might be to grab a pair of tweezers and yank that stinger right out. Stop. Do not do this. Tweezers can actually squeeze the venom sac, pumping even more venom directly into your skin. Instead, the 2026 guidelines tell us to scrape the stinger out sideways. You can use the edge of a credit card or just your fingernail. Once it's out, simply wash the area with some soap and water, apply a wrapped cold pack for about 10 to 15 minutes to take the swelling down, and use some calamine or 1% hydrocortisone to keep the itch under control. But hey, your job isn't done just because the stinger is out. The number 30 is your magic metric here. You've got to observe the person for exactly 30 minutes. You're looking out for signs of anaphylaxis, stuff like sudden hives, swelling around the lips or tongue, or any sort of wheezing. If you see those, there's no waiting around. It is an immediate 911 call and time to hit them with epinephrine, if you have it. Let's move over to ticks and see how this builds on our backyard hazard protocols. Now, unlike bees, you absolutely do want to use fine-tipped tweezers for ticks. You're going to grip that tick by the head, right down at skin level, and pull straight up with steady pressure. No twisting, no jerking it around. And please, absolutely no folk remedies. Lighting a match, slathering the poor thing in petroleum jelly, painting it with nail polish. These are terrible ideas. Why? Because they literally cause the tick to regurgitate its stomach contents right into your bloodstream, which skyrockets your infection risk. Just pull it straight out, clean the area up, and jot down the date. And look at that, the number 30 pops up again, but this time it's 30 days. You need to keep up a symptom watch for roughly 30 days to check for Lyme disease. What exactly are you looking for? Keep an eye out for an expanding bullseye rash, an unexpected fever, or severe joint aches. If you spot any of these, get to a doctor immediately. Early antibiotics work incredibly well. Moving right along to Section 2, snakes, spiders, and bites. Let's raise the stakes a bit. Okay, quick pop quiz. What is the very first thing you should do if you or someone you're with gets bitten by a snake? Think about everything you've seen in survival shows or action movies. Got your answer? Let's see if you're right. It is time to dismantle the most dangerous cinematic myths out there. The old 2003 movie myth. It told us to cut the wound, literally suck out the venom, ice it down, and tie off a tourniquet. The 2026 reality strictly forbids all of that. None of that movie stuff works, and honestly, it actively causes severe tissue damage. Your actual first step? Call 911. Antivenom is the only real treatment. You need to stay perfectly calm to keep your heart rate from spiking, splint the limb and keep it in a neutral position, roughly at heart level. And here's a brilliant, life-saving trick for you. Grab a pen, mark the very edge of the swelling on the skin, and write down the time next to it. That tracks the venom's progression for the doctors when you finally get to the hospital. Now, what about spiders? Most spider bites are minor, sure, but you really got to know the dangerous ones. A black widow bite often just feels like a tiny pinprick at first, but it's rapidly followed by intense, cramping abdominal and muscle pain along with heavy sweating. A brown recluse bite, on the flip side, develops into a visible ulcer with a really distinct red ring, accompanied by a fever and weakness. Both of these require immediate medical care. Always check your shoes and those dark wood piles where these guys love to hang out. And if you are bitten, and only if it's safe to do so, bring the dead spider in a container. Proper ID guides the exact medical treatment you'll get. Before we leave this section, a quick word on animal and human bites. The number to remember here is 5. 5 solid minutes. Animal and especially human mouths are absolutely loaded with bacteria, so these wounds are dirty by definition. If the skin is broken, you must wash the wound hard with soap and running water for at least 5 minutes to prevent a nasty infection. And always get it checked out by a professional within 24 hours. Time to head to the beach and the trails. Section 3, jellyfish and poison ivy. So we have all seen that famous 90s sitcom episode where a character gets stung by a jellyfish and the proposed solution is, well, urine. But if you don't do that, what about a quick rinse with a bottle of fresh drinking water? Which one is right? Trick question, neither. And this perfectly illustrates how these myths get perpetuated. The sitcom myth of using urine, pouring fresh water over the sting, or trying to scrape off the tentacles with a credit card, it's completely wrong. Fresh water actually causes the stinging cells, they're called cnatocysts, to fire even more venom right into your body. The 2026 reality is that you gotta get out of the water and rinse the area with vinegar for at least 30 seconds. Vinegar actually disarms those stinging cells. If you don't have vinegar on hand, just use seawater. Then, carefully lift any remaining tentacles off using tweezers or a tool. Never your bare fingers, and absolutely no scraping. Once those stinging cells are deactivated, the pain management begins. You want to immerse the sting in hot water, honestly as hot as you can comfortably tolerate. Specifically, we're talking around 43 to 45 degrees Celsius. A good 20 to 40-minute hot water soak breaks down the venom proteins and is amazingly effective at managing that extreme pain. Back on dry land, dealing with poison ivy is all about speed. You have a very tight 10-minute window to wash your skin with soap and cool water. You have to get that invisible urushiol oil off before it bonds to your skin. You also have to decontaminate everything, your clothes, shoes, tools, even your pet's fur, because that oil will transfer and cause rashes for days. If a rash does pop up, soothe it with cool compresses and calamine. But listen to me, the absolute golden rule here, never ever burn poison ivy, oak, or sumac brush. Burning it releases the oil into the air, and breathing that in can cause life-threatening internal reactions. Moving indoors for Section 4, Everyday Eyes and Dental Care. Okay, picture this scenario. There's a bad fall or a sports accident, and a permanent adult tooth gets completely knocked out. What is the single most critical factor in saving that tooth? The answer is time. Time is the whole game. You have a 30 to 60-minute window to get to a dentist, but how you handle that tooth in those minutes completely dictates if it survives. You must only pick it up by the chewing surface, the crown. Never, ever touch the root. Rinse it gently, but whatever you do, do not scrub it. The absolute best thing you can do is push the tooth right back into the socket and bite down on some gauze. But if you can't do that, here is a really surprising but vital fact. Transport the tooth in a glass of milk. Yep, milk perfectly preserves the cells on the root until the dentist can actually reimplant it. Moving over to eyes and ears, let's talk about the absolute nevers. If you get a speck of grit in your eye, just blink in clean water. But never rub an injured eye. If something is embedded in there, cover it up and go straight to the ER. If it's a chemical splash, you need a continuous 20-minute flush with water, directing the flow from the nose outward so you don't accidentally wash the chemicals into your good eye. For your ears, never insert cotton buds, oils, or those weird ear candles into an aching ear. Just stick to warm compresses. And hey, what about a black eye or a minor bump? That classic improvised cold pack, a bag of frozen vegetables wrapped up in a towel, is actually still considered a highly smart and effective move under modern guidelines. And finally, Section 5, the modern first aid kit. Go to your bathroom cabinet right now, and if you see any of these items, I want you to physically throw them in the trash. These are 2003-era museum pieces that we now know do way more harm than good. Ipecac syrup used to be the go-to for poisoning to induce vomiting. Never do that anymore. Just call poison control. Pouring hydrogen peroxide into open wounds? Stop. It literally damages healthy tissue and delays healing. Irrigate with clean running water instead. And those snakebite cotton suction kits, like we learned earlier, those belong in the garbage. So what actually belongs in your 2026 kit? You want your staples, gloves, plenty of gauze, bandages, medical tape, antiseptic wipes, proper fine-tip tweezers, and trauma scissors. You also want a foil blanket for shock and a CPR shield. But pay close attention to this major update regarding tourniquets. For a really long time, people were terrified of using tourniquets. That hesitation is entirely gone. The modern recommendation is that for life-threatening limb bleeds, a proper tourniquet is absolutely essential. Finally, consider stocking oral rehydration salts and, where appropriate, naloxone. I want to leave you with this really powerful thought. Myths bite harder than snakes. Knowing the right moves, whether it's the scrape, wash, watch mnemonic for stings, transporting a knocked-out tooth in milk, or keeping a snakebite immobilized at heart level, these are small moves that result in massive saves. Do not let movie myths dictate your reaction in an emergency. I highly urge you to sign up for a certified Red Cross or local Red Crescent course to turn this knowledge into true muscle memory. So ask yourself, if an emergency happens tomorrow, will you be relying on 2003 Hollywood drama or 2026 science?